Hey viewers, you're watching The Savera and I'm Vidhi Joshi. Weeks after a deadly contaminated water crisis claimed 25 lives in Indore, another serious public health scare has surfaced in the same district. And this time the outbreak has been reported from Mhow town, where more than 22 people, most of them children, have fallen ill over the last 10 to 15 days after allegedly consuming polluted tap water. Notably, several of the affected children are currently undergoing treatment in hospitals, while others are being treated at home. Health officials confirm that at least 22 people have shown symptoms of jaundice, typhoid, and other waterborne diseases. 8 to 9 patients have been admitted to the hospital. The authorities say that no patient is in critical condition at present. District Collector Shivam Verma stated that a health department team was immediately dispatched to the affected areas and that specialist doctors from Indore Medical College are also being sent in order to assist. Notably, this outbreak has been reported mainly from Mhow's Patti Bazar, Moti Mahal and surrounding localities, and residents allege that foul-smelling, muddy and visibly contaminated water has been supplied through household taps. Locals said that even after boiling the water, thick sediment continues to collect at the bottom of utensils, raising serious concerns about the quality of the supply. According to the residents, people begin falling ill soon after consuming this water, and children have been the worst affected by this outbreak. In several households, multiple children have fallen sick at the same time, and school-going children have been confined to bed, forcing many to miss classes and examinations. A Class 12 student, Elena, was unable to appear for her pre-board examinations due to illness, while 9-year-old Lakshita and 12-year-old Gitansh are undergoing treatment for jaundice. In one family alone, 6 children have reportedly been unwell for several days, and the situation is said to be more serious in the Moti Mahal area, where young children have been hospitalized and an elderly person has been referred to Indore after being diagnosed with a liver infection. Notably, residents have accused authorities of long-standing negligence, claiming that they had repeatedly complained about contaminated water. Locals allege that drinking water pipelines run through open drains and sewage pits, and leakages at multiple points have allowed drain water to mix with the drinking water supply. Following reports of the outbreak, the administration swung into action as Indore Collector Shivam Verma reached Mhow late at night, visited the Red Cross hospital, met affected children and their families, and spoke to the residents in the affected areas. He directed doctors to ensure timely and effective treatment and warned that negligence would not be tolerated. He also instructed the Mhow Cantonment Board to immediately check water quality, stop the contaminated supply and ensure cleanliness, and provide alternative drinking water arrangements to everybody. Well, Mhow MLA Usha Thakur also visited the hospital and affected localities, reviewed the entire situation and instructed officials to ensure adequate availability of medicines and immediate medical care. She assured residents that a technical inspection of the water pipelines would be conducted in order to find a permanent solution. Under the directions of Chief Medical and Health Officer Dr. Madhav Hassani, health department teams have begun intensive door-to-door surveys in order to identify new cases. Patients with mild symptoms are being treated at home, while serious cases are being hospitalized without any delay. Water samples have been collected from affected areas and sent for laboratory testing in order to confirm contamination. And officials say that the situation is currently under control, but the administration remains on high alert. Collector Verma has stated that those responsible for lapses in the water supply system will be identified and strict action will be taken. Notably, the Mhow outbreak has once again raised serious questions about the safety and monitoring of drinking water systems in the Indore district, especially in the wake of Bhagirathpura tragedy, where bacterial contamination later confirmed to include E. coli due to sewage mixing with drinking water pipelines, which led to the widespread illnesses and multiple deaths. While no fatalities have been reported so far in Mhow, and authorities say that close monitoring will continue in order to prevent the situation from escalating further. That's all for now. Stay tuned to The Savera for more updates. Do like, comment and subscribe to the channel.